Sure. Assalamu alaikum and a very good morning to all of you here. On behalf of the founder president, Dr. Tumbe Moeddin, Gulf Medical University, the alumni office. Assalamu alaikum and a very good morning to all of you here. I welcome you all to GMU Career Fair 2024, Connect, Network and Succeed. I'm sure all of you visited various partners. We have more than 60 plus partners who have participated in this particular career fair, and we thank them all for joining us today and making this a grand success. A big round of applause to all our partners. As a chancellor used to say, nowadays the classrooms are, beyond borders, beyond boundaries. It is something like that. And our classrooms have become mostly online and small groups. But I think it's very important for us to all gather here, network, so that we know what is in the future and what the industry is expecting out of our future students. We are here, GMU is one of the biggest medical university in the region, and we train almost more than 5,000 students, and they all come out with real expectations, and we are here to support them all. Today, we have organized two panel discussions. One is Future of Healthcare Careers, Navigating Trends and Opportunities, and the second panel is From Classroom to Career, Transitioning Successfully into Medical Workforce. I think it will be very interesting to hear all our panel experts. We have Mr. Pankaj, Dr. Fauzi, Medical Director, TUH, Mr. Austin Shaju, from Chief Operating Manager, 360 Medicare Healthcare Staffing and Recruitment, Dubai, Dr. Asma, Head of Medical Education and Research Specialist, Pediatric Dentist, Apollonia World Group, Dr. Zaik from Pharmacy Operations Manager, Altika Pharmacy. This is the first panel, but before that, I request our Chancellor to please give a keynote address and proceed with the panelists.
Assalamu alaikum, bismillah ar-Rahman ar-Rahim. We are very happy today to have you here with us. I thank you all, our industry partners, our colleagues, students, alumni, and the faculty, the deans, who have organized this wonderful event, and particularly Mr. Vignesh and his team in marketing, and the Alumni Association, Romer and his team. Putting all this together is very important. And you can see that the value of this is to introduce and to develop and to modify the development of the healthcare professionals who will be needed to the future of the healthcare world. And today we're going to have two sessions, two panel discussion sessions. I will moderate the first one, and my colleague, Professor Rolf Hartung, will moderate the second one. So panel one will be about the future of healthcare of healthcare and careers opportunity. What is happening in the healthcare system, not only in UAE, but all over the world. And I have the pleasure of having the panelists on the first panel discussion. And I would like you please to come here, Mr. Pankaj Sohani. Hello, sir. Professor Fawzi Dakhilan, Mr. Austin Shaju, and Dr. Asma El-Nabata, and Dr. Zakiya. Thank you. So, thank you very much for coming here, and they will be, after you introduce briefly each one of you to the audience, so they understand your background and from where you're coming. And then we'll have a discussion to listen to how you see the future of healthcare. So let's start, maybe Mr. Pankaj. Is there a mic? Where's the mic? Yeah. Just a brief introduction about yourself.
Good morning, everybody. My name is Pankaj Sohani. I'm the entrepreneur. I have been here into the country for last 20 years in healthcare. And we have recently started diagnostic medical laboratory called Q Labs, which is based in Dubai. It's a referral laboratory offering the services to all GCC.
Thank you.
Dr. Fawzi Dakhilan, consultant neonatologist and medical director of Thumbay University Hospital, I think just in the corner there. Originally, I'm from Libya, a small town in Libya. Trained as pediatrician and a neonatologist in the UK. I was a consultant neonatologist in the UK, and then I moved to UAE many years back, and now consultant neonatologist in the hospital as well as medical director. I hope that you will be our colleagues in the future, and possibly will take over the profession forward. So that's it.
Thank you.
Yeah.
Good morning. So my name is Austin, and the operations manager of 3Stream Medicare. We are a healthcare staffing company. We do recruitment for healthcare professionals from all over the world to most of the countries in the world. That's about me. We can discuss further. Thank you.
Yeah.
Hello, everyone. I'm Dr. Asma. I'm the head of medical education and research at Apollonia World Group, a specialized center in pediatric dentistry. So I'm a specialist pediatric dentist. I would like to thank you for the kind invitation and for our ongoing collaboration with the Gulf Medical University and the College of Dentistry.
Hello, everyone. My name is Zakiya Abulkhair. I'm the Pharmacy Operations Manager at Al-Thaqa Pharmacy Group. It's a group of pharmacies based in Abu Dhabi with different specialties in pharmacy. My background is bachelor's degree in pharmacy from University of Sharjah with a master's degree in specialty pharmacy, pharmacy business administration from University of Pittsburgh.
Thank you very much. So, you can see we have colleagues here from different backgrounds, different perspectives, which definitely they will bring new vision on seeing the world of healthcare from different perspectives. I want to start by saying that medical education or health profession education is a social science. And it is embedded in the healthcare system of the country, nationally, and the world is connected now so globally. And what is happening is that the healthcare systems is changing very rapidly. And the medical education is lagging a little bit behind it. So that's why it is very important to see through your lenses, what is happening in the healthcare and how we should take in consideration how is the practice going to be in 5 years or maybe even next year, or today is changing. Everything is very rapidly changing. And we are preparing students to work in a world which we don't know exactly how it's going to look like. So let's start by diagnostics and the importance of diagnostics and how the world and how the practice in what is called perhaps precision medicine based on all the diagnostics which has to take place. Give us, how do you see the future and what we should do from our side as educators?
Great. So healthcare system is a big ocean, and same diagnostic is another ocean within the ocean. Actually, the diagnostics field has been multiple folds rapidly expanded. It's what it used to be 10 years ago. It's completely 360-degree change now. Now, we are talking about precision medicine, which is basically personalized medicines. What medicine I'm taking will not be suitable for him or him. So we are based on a diagnosis, we can go for a personalized treatment, personalized care, and that's what a precision medicine is. Now, with genomics, with AI, with algorithm-based diagnosis, we are able to predict biological age, which was probably we started telomere testing 3-4 years ago. And with now genomics data, we can start telling you that my heart age is probably 40, but my biological age is 45, and my kidney age is reaching to 48. So I should know that my kidney has to be taken care in a better way. So my lungs age, my everything. So each organ can be defined with the biological age. And we know that which organ need to be taken care further. So we have gone much beyond the diagnostic, what used to be, we see it in a microscope, or we used to consider as a laboratory for blood, stool, urine test. No, not anymore limited to that only. So really we have to keep eyes open, keep every day onto the subject, what's happening new into the healthcare.
That's amazing. I mean, I think everyone here wants to know the age of his kidneys and of his lungs and brain, and maybe. Wonderful. So we have to prepare, we have to know, or all health professionals, they have to understand a little bit more in depth of genetics.
So this is what exactly, like we can, if we know the tissues health of a brain, we can probably stop doing Alzheimer, Parkinson's disease much ahead of it. So this is what the diagnostic is today.
Absolutely. Excellent. Professor Fawzi, you are representing the physician in general, the one who prescribe and who treat and heal the patients from babies. I know you are specialized in neonatology, but you present the whole spectrum of curative or clinical medicine. So what's your take on that?
When I was graduated, the medicine was a little bit different from the medicine that we do now, but it's not that different. Our view, I think, with the technology, with the advancement in science, we start to think that the advancement will give us a big jump and quick jump. But still the basic has to be right. Whatever, I know people, they are talking about the AI, and then the AI will take over, and I think it is in the mind of most of the medical students now, not just medical students, any other specialty. So the notion now that the AI will be taking over the next in our mind in a few years. The reality maybe a little bit different. The basic has to be right. You know, what you are studying now, like the knowledge and the skill and the attitude that governs how do you do with the knowledge and the skill that you obtain during the time of the MBBS or other specialties. So it is true that we are advancing and we have to take it serious, but we have to be realistic about the pace and the future. People think maybe in the next few weeks, maybe few months, that the AI will be doing everything. I have some skills in the IT. I learned in the early 90s how the computer works and what is the 0, 1, 1, and those kind of things. And the people, they talk about the singularity of the AI, which where the development would be like almost right angle. It is not in this way. So I will go back to the basics that you have to have, the competence in your professions. We know that sometimes we may in the future, we lose these kind of IT and the AI, we may lose it. We know we are not separate from the politics that going on in the world. So what I'm trying to say is that the basic has to be right, the knowledge, the skill, and I will talk about a little bit about the behavior or the attitude toward the environment that you'll be in. So when I interview people, when I get the CVs, and this is now, I think you'll start to say, oh, now you'll open your ears now. Now, when I get the CVs and I select people from the CV, I will see the interest of the person. So imagine that you will be applying for pediatrics, and this is very important. You need to listen to this. Imagine that you are applying to pediatrics and you'll be selected and you'll be going to the interview. And then in the interview, you will be talking, saying, oh, I am very interested in pediatric. I want to do this from my childhood. Even before I was born, I was thinking of pediatrics. But the CV has to tell, and we learn from the CV. If you did like your selectives in psychiatry and the other selective or elective period in neurosurgery, so your CV tells something different. So before you apply, you have to prepare from now. When you do your electives, you have to choose the 2 or 3 subjects that you are interested in. So especially if you apply to the Western countries, when I select candidates in the UK, that's what I go to the CV and I'll see what is the interest of this candidate.
Fawzi, we'll come more to this in the
Okay.
next round of
All right, okay.
questions.
So I will if you want advice about this, I'm in the hospital, but that's very, very important and very, very serious maybe during this election time.
Thank you,
to
Dr.
take
Fawzi.
a long time because
Now,
I think I'll...
Austin, your company 360 Medicare health care staffing and recruitment.
Yes.
So what you do, my understanding is that you prepare them, you prepare all health professionals
Yes.
in how to find jobs,
Yes, for the careers.
not only in UAE, but all over the world. And that's why how they should be well prepared. So again, give us your perspective on what do you think now globally, what they are expecting from a healthcare professional, regardless of his specialization,
Yes.
and how they can early start working on that in order to respond to what you think is important for employability after they graduate.
Definitely.
Give us your perspective.
So, in terms of healthcare professionals' career, you all are healthcare professionals and you are all planning for a good career opportunity in terms of UAE or any other countries overseas, UK, Germany, New Zealand, Australia, wherever. You all are, I do agree with Professor, first of all. Preparing a CV is a minute thing. That's the first thing you have to do. And for an interviewer, any employer who does an interview, they mostly ask you whether you are flexible to work in any department. Mostly everyone says that I only specialize in this and I'm ready for pediatrics or cardiology, whatever. To be frank, that is the wrong answer. You should be flexible to work in anything and you should be adaptable to the technologies. So as you know, every university, even GMU, is providing AI related courses and everything. So these kind of courses will make you adaptable. And in terms of an interview or in your career, when you are going to find an employer, definitely these things will guide you to get an opportunity with good career options, which is in terms of earnings and career. So why you should choose this flexibility or adaptability is because the person should feel like you're not only a candidate who can work in a specific thing, or you can only do this one, a specific job. You are ready for everything. That is what everyone requires. Who does one job is not the only answer for this. So this is what I could say for career options mainly. Then, yeah.
So, and you're not talking about, and this is important, we're not talking about physicians.
Yes.
Because it's a teamwork.
Yes.
And this is the future. It's not the individual doctor who is treating the patient, but the whole team, the pharmacist, the nurse, the doctor, the physiotherapist, everybody.
Yes.
The diagnostic, they work as a team. Okay, Dr. Asma, let us, you are in education now.
Yes,
You are head of education,
yes.
although you are a dentist or in dentistry, but there is no difference in educational principle between dentistry and others.
Right.
So how do you see through your lens of preparing the future health professionals? You can focus on dentistry, but it's
Yeah.
not the pedo or
Yeah,
it is
exactly.
much more than that.
Yeah, exactly. So I would just like to give an insight. 10 years back when I came to the UAE, the day that I took the licensing exam, I got 3 calls to be employed without even having to submit my CV to anyone. So recruiters were waiting for people to submit into the exam, and then they were calling the candidates. So this thing has definitely changed for all healthcare professionals. Now the competition is higher and the recruitment is kind of less. So what I would advise dentists who are among and other healthcare professionals is to invest in three things. The first thing is to volunteer and expand their networks. And this is why you're doing such a career fair. So they would expand into new networks. The other thing is to know about the new innovations, each one in the field. So for dentistry, for example, they would need to know what is new. And the third and the most important thing is to invest in their specialties and in some cases, subspecialties. And from this, it came our collaboration and the MOU that we have signed with Gulf Medical University is to enhance the specialists and to enhance the medical education of our doctors as well. So students need to know when they are in their 5th year or in their internship year on what they will do next. So for the market right now, without specialty in dentistry, the scope of practice is very limited and they cannot kind of survive in the market without having a specialty. The good thing is that at university, you are already having the NIHS accreditation, which allows the students to be considered as a specialist the moment that they finish their postgrad study. And this is excellent. Before they need to wait for 3 more years and then to take the specialty license. Right now, things are a bit easier for the graduates inside the country. So this is my recommendation to go for specialty.
Thank you. Let me ask the question to Dr. Zakia as she represents pharmacy, and then I will ask one question, same question to all of you. Dr. Zakia, now pharmacy. What do you want from the future pharmacist?
So as you know, pharmacy is evolving very rapidly. There's a lot of different sections that pharmacists can be involved in. I'm going to talk about like 4 main different specialties that pharmacists might not know of and are considered to be futuristic in some other parts of the world. So first of all, digital therapeutics. So they're like digital applications that are cleared from the FDA to manage, treat, or prevent a disease. You can read more about it, but they're being very popular in the UK and US and in the European countries. So that's something that pharmacists can decide to get into if they're not really, don't want to get into either community pharmacy or hospital pharmacy, because that's what usually what graduates think, that those are the only 2 options, or if you want to work as a medical representative in a pharmaceutical company. So that's number 1. Number 2, there's a new concept called specialty pharmacy. So it's a pharmacy that is focused only on specialty medications, which are high-cost biologics. So as you know, there's a lot of biologics coming into the market, and trends tend to forecast that there's a huge percentage of these medications that are going to be biologics. So I think we should prep our students to know how to deal with these medications, because they're very complex for very complex diseases. The third is a DMEPOS, which is called Durable Medical Equipment, Prosthetic Orthotic Pharmacy. So it's like a pharmacy that is focused on medical devices. It has a very different way of taking approvals through insurance. So I feel like that area is not really tackled on, but it's very important because, medical devices is a whole different world. What I really think that pharmacists should really focus on, like when doctor was saying that, you have to really show what you're specialized in when writing up your CV. So when I want to look at the CV, I'm not just going to look at a pharmacy graduate from GMU with, having some undergraduate internships. I'm going to look at if you've done, let's say, if you love oral nutrition supplements, I'm going to look at if you specialized in some courses that are related to that. If you're very interested in digital health, then I would look at, some certificates or courses or volunteers and places that provide that. So you have to really choose what you love and forget about the judgments, forget about what, your friends look at or your, your school instructors say. Whatever you like, you guys have to choose that, because you're gonna هنبدع فيه شو يعني we're gonna shine on that, exactly. So I feel like we don't really have to, you know, if you decide to be a medical representative, that's not supposed to be shameful. This is what you like. So we have to stop shaming one another for choosing whatever we like and what we want to do, because at the end of the day, we're pharmacists. We're the end customer is the patient. We're all serving for one main goal, which is to serve the patient, whatever the, you know, path is. And last but not least, I'd like to see pharmacists have some skills in project management, because pharmacies are really getting into, you know, including a lot of projects. So project management skills is very essential, whether it was from, you know, creating a plan, resource allocation, creating deadlines, getting the plan done. So you can, you know, I don't know if you guys know PMI. So usually people get into PMP, but you need experience for that. But there's something that is, you know, that doesn't require much experience, like CAP, which is Certified Associate in Project Management Skills. So that's something that I would expect from graduates.
Excellent. Thank you very much. I will take from where you have ended now, because many of you have focused on dentistry, on medicine, on diagnostics. But let's forget the identity itself. But there are other things, because this will constitute specific knowledge and specific skills in practice. But there are other domains which are inseparable from the practice of health professionals now and tomorrow. So let's not focus on this. What other domain in the makeup of a health professional for the future? You mentioned, for example, management. Do dentists need management? Do physicians need management? Do you are an entrepreneur? Do you need management? And other things which will be needed in the coming world of healthcare. What do you think?
Certainly, like you have to be specialized, but as you said, we have to have add-on skills, which comes from definitely by enhancing our knowledge. As being an entrepreneur, I have not studied the finance, but now I've been called as a man of numbers. So my job is to look at the numbers every day, numbers.
I read that you were microbiologist.
I studied microbiologist, and then for my own knowledge, for your students' point of view, I had no relationship with IT, but in spite of that, I have completed my master's in computer application. Just to be competitive enough in the IT industry, though I have no plan to go into the IT, but to compete, to understand the AI world and information technology, I have completed my master's in computer application as well.
Right. You're not planning to be a computer scientist.
No.
You are a health professional or scientist.
I'm a health professional, but this
want to
computer,
understand and use
yes,
the technology.
So I can any IT graduates or IT professionals comes and talk to me, I can talk to them on their level.
Exactly.
Right. And my next task is to complete my business administration.
You see, fantastic. you have a place here. Where is Dr. Moon?
I would love to come here.
Fawzi, Dr. Fawzi.
Maybe
Forget about pediatrics
no,
now.
I'm not talking about pediatric at all. As Pankaj mentioned, possibly I said it in 2 words. When I was junior doctor, I did training in IT. Actually, I went after my work. I went to university in Libya, where I learned the computing. And now, after so many years, I don't want to go through the details because I'll take time from the schedule. You know, in our hospitals, in our group, we didn't buy our electronic medical records. We did it ourselves. We built it in-house. So I sat with the IT staff, with developers, and we made the electronic medical records. So this is one of the things that you have to have. It's not just focused on the medicine, because what happens when you have so many skills, like knowledge outside of the medicine, skills outside of medicine, that will make you stronger, and people will notice that. You don't need to go and run around. I have that skill, I have that skill, I have that skill. When you start to implement your skill during or inside the work, people will notice that. They will see that, and they will recognize that. And maybe mentioned the employability, and your employability will be like jumping compared to the rest. So the other part is the management. You know, we in the UK we have what we call the CCT, or Certificate of Completion of Training, or CST, Certificate of Completion of the Subspecialty Training. Before they give us the certificate, we have to go to a management training. We have to do courses. We have to do workshops. We couldn't get the certificate unless we go to management. So every person has to manage others. Sometimes you'll be managing only 3. So you'll be manager or a leader. When you are 3 on call, for example, 3 people on call, one of you will be leading and managing the others. And so the management and other skills, like the soft skills that you will have, it will improve your employability. And the HR will tell you about that.
Let's ask him now.
Yeah. So what? Okay. So maybe you will tell me when you see a physician or pharmacist, or when that person write that I have this IT skills, maybe management skills.
So Austin,
what is the?
let's give Austin the floor to say something.
No, he wants me to stop.
Yes. Well, you know, Austin, they're talking about IT and management.
I'll start from where you stopped. So definitely this point is actually accurate. You should be really ready to go with any domains in terms of skills. See, I'm from finance background. Basically, I done with my cost management. Then I'm dealing with some other profession, which is not entirely nearly to my domain. And what everyone here is going for different things, because we should be adaptable for the new skills, and that is what will make us grow individually as well as in career. So what I could say is, like, when you're as he mentioned, Professor mentioned, when you see a skills that really gives an employer or a person who looks your CV an impression that this person is capable of dealing such kind of duties or responsibilities, and that will give you a leadership quality. That's it.
Thank you. Dr. Asma, what's your take on that?
Yeah, I cannot agree more on the importance of additional skills for any healthcare professional. That's why I did a master's in quality in healthcare management in general, and a PhD in public health. And I can tell that I could not be the one who am I at my workplace and teaching if I did not do that, and if I did not go out of dentistry as a scope. The research skills are so important. So when you are dealing with patients, you are giving the evidence base behind any procedure that you will be doing, and the healthcare management as well, in terms of managing the whole team, as the doctor said. So I cannot agree more on the importance of other skills and domains other than pure medical or dental skills.
Dr. Zaki?
So in addition to the project management skills that I was talking about, I think one important skill to learn is selling skills. Because at the end of the day, we're all trying to sell something, right? I'm trying to sell maybe a position for a pharmacist. You're trying to sell something in dentistry. The university is trying to sell some seats at the university, right? So, but without proper knowledge you won't be able to sell. So I feel like if you guys have a very strong education and very strong clinical knowledge, you're going to be able to sell whatever it is in your pharmacy or in your clinic or in university, whatever it is. So I think this is a very untouched area that we really tend to not focus on, but we're all at the end of the day selling an idea to the public.
So that's negotiation skills, communication skills.
Yes.
And by the way, what Dr. Fauzi was alluding at, saying the soft skills, I have changed these names now because the knowledge and the clinical skills, we know to some extent what they mean and how to teach it and maybe how to assess it. So this, in my opinion, are the soft skills. The hard skills are the other ones, the communication, the empathy, the negotiation skills. These are the real hard, which we need to pay more attention into it. Before closing, I just want to say that at Gulf Medical University, we were very conscious of what the panelists have been talking about it. And there are two elements about, you'll see it on the wall here, learning together for working together. So the teamwork is here and we are trying to do it. The second, we have introduced vertically in all the curricula, technology and IT and other skills like humanities and so on. So because these are integrated and they are not separate. So I really want to thank you all for your valuable input and for sharing with us this fantastic occasion, the Career Fair 2024. Thank you very much.
Thank you, Chancellor, for moderating the first panel. I request all of you to be seated. We move to the second panel discussion, and I would like to invite Dr. Rolf to please moderate the second panel discussion. We have eminent speakers, Dr. Shihad Kader, CEO, Tumbes University Hospital and Tumbes Hospital Ajman, Hala Abu, Head of Therapy, Mr. Barhunuddin Sahibil, HR Manager, Middle East, Tabuk Pharmaceutical, Dr. Salahuddin Abu Bakr, Medical Director, Pearl Dental Clinic, Dr. Dalia, Medical Director, Medicure Polyclinic, Ms. Tracy Lee Hendricks, Director of Nursing Education. Please be seated.
Oh, sorry. Now we have 6? 5. Yes. Again, good morning. Thank you very much, dear Chancellor, for giving me the opportunity to moderate the second panel discussion. I was listening carefully to... Yes. Come. Yeah, it's fine. Please take the chair. I was carefully listening to what all the panelists have said, and I have, of course, my own idea about it. I'm a little bit on the older side already, so when I started medical education, which I did actually in 3+1 continent in this globe, and I heard you have to be global and all this has changed. It was the same 50 years ago. So you could go globally and learn in Europe and practice in Africa and learn again in South America and come back now here to Middle East, which I believe geographically belongs to Asia, which comes to four continents out of 5. So it is possible, and it should be an encouragement for all the young people to do the same. The world became smaller and the competition has increased. So go out there and choose what you want to do. Now, this is a kind of topic for this panel because the theme of this discussion will be from the classroom to the workforce, or from academia to really your profession. And this is something all of you students have to decide, whether you choose now neonatology or whether you choose surgery. You should be open and see what's going on. And the market, of course, also somehow directs you to somewhere where you want to go or where you actually didn't think to go in the very beginning. Now we have all our panelists. I will do the same. Please take your mics and introduce yourself.
Hi, good afternoon. Thank you so much for having me here. My name is Dr. Salah. Everybody calls me my name is Dr. Salah. I'm the CEO of Pearl Dental Clinic. We have 2 branches, Business Bay and Jumeirah. I've been practicing dentistry for the past 25 years. I'm pretty much like you. I grew up here in Dubai. I did all my schooling here. And yes, and I never knew that in my career that I will be having 2 branches and over 10 dentists working with me. I never imagined that, but it's a long journey and I would like to talk to you all about it.
Assalamu alaikum, Bismillah ar-Rahman ar-Rahim. I'm Dr. Shihad Khader. I'm the Chief Operating Officer of the building next in the campus. It's called the Tumbay University Hospital. Actually, it is, it's great to come here. I would like to congratulate Professor Hamdi and the whole team who have organized this event. I think it's a brilliant idea to have students talk to different leaders, different people in different sectors, as well as different organizations, not just the Tumbay Group and other participating or places that you go for your training. So thank you for having me here. Though I literally live in the next building in the University Hospital, I don't get to come to this place. So thank you for that as well. Always great to come here to this prestigious university, Gulf Medical University. I've seen this as a youngster because I'm an alumni of this university. So literally classroom to workforce. So thank you. We look forward to having engaging discussion. Good, nice, hard questions from Professor Rolf, and also any of your questions from the students here. Thank you.
Hi, hello everyone. My name is Burhanuddin Shibli. I am the HR manager for the Tabuk Middle East region. And I'm really, really thankful for GMU to invite us all here. And just want to say something about especially for the students here, because we are here for you guys, so you can ask any questions from us. That is the thing when you start your career, when you're going into the market in a different world, that's where you start. You start asking question from your mentor, from the people who are there in the field for some quite of time. Apart from that, my background is psychology, and I'm a human resource management graduate as well. And I'm in the region for almost 12 years. Thank you so much.
Hello, my name is Dr. Dalia. Well, I graduated from this university, but the first time I entered this university was in this specific lecture hall 12 years ago. Okay. So I am so thrilled to be here today, very honored to come here and guide the students the way this university guided me. So literally from classroom to career, and today I am in the place where the doctors were giving me these steps to be who I am today, a successful person in my career. I am a medical director in Medicure Polyclinic, which is actually one of, I'm taking care of 3 branches, not only one. So it's a very big step for someone who just graduated like a few years ago. And I feel like one day those students have, they shouldn't be confused or nervous. And one day they will reach to this stages just because of this university.
So if anyone has a question, any doubt, anything, please, you can ask me, as well as you can ask the amazing professors who are here today, who were also with me during every step, especially Dr. Walid. So yeah.
Assalamu alaikum. I'm Hala Abul Haj. I'm a senior occupational therapist and head of therapy at Inara. It's an AI-powered platform for early intervention for neurodiverse children. I have over 20 years of experience working as an occupational therapist. I'm a professional trainer. I am also a life coach, and I enjoy and love my work so much. So hopefully I can help you and guide you as well with the others as well. And I also worked, by the way, in Jordan, Saudi Arabia, Kuwait, and UAE.
Good afternoon, everyone. I'm Tracy, and I'm the Director of Nursing at King's College Hospital, Director of Nursing for Education and Research. I have about 25 plus years of experience as a nurse and as a midwife, and I've worked here in Saudi. I'm originally from South Africa, and I've been here in the UAE now for the last 16 years. Predominantly, my career in the UAE has been in Saha in Abu Dhabi, and I've 3 years ago relocated to Dubai, where I'm now currently working as the Director of Nursing for Education and Research. It's lovely to meet you all, and thank you so much for having me.
Keep the mic, Tracy, please. So we will do it from left to right now.
Oh.
So different. So first of all, thank you very much for joining, and I'm very happy to see a Director of Nursing here sitting in front of the medical students. My question to you is, what do you think how we should train our students for interprofessional work? So we try our best to do interprofessional education, but interprofessional work, it's fine. I'm a surgeon. We are used to stand day and night. Yeah. So what do you think is required in terms of education and in terms of attitude from our young doctors to cope with this changing type of work in the hospitals, where, as our Chancellor has already said, teamwork became much more important. When I was a young surgeon, everything on me. Yeah? But today it's not like this anymore. So what do you think is important to know for our students how to cope with this?
So first of all, I mean, transitioning from a student into becoming a full-fledged professional is an extremely difficult and challenging, but it's also such a transformational moment in your life, moving from a student now to academia. So I think the challenge is for everyone, whether you're a nurse, whether you're a physician, whether physiotherapy, that challenge remains the same. I was actually looking at some research and trying to look at some research that can assist or help or new students transitioning, and I couldn't really find anything. And one paper that I read said that there's so little information with regards to this transitioning of a student into a full-fledged professional. And I think that is something that we definitely need to work on. Now, the whole dynamics has changed over the years. I think there's much more of a better relationship between nurses, physicians, and the approach is very multidisciplinary. So it's not a one-man's job. It's a teamwork. And I think that's what we try to advocate at our hospital, at least, that students, any student that comes to the hospital, understand that they are part of the greater multidisciplinary team. I think also what's important is that socialization is so important. Some of the themes that came up with some of the papers that I read was socialization is such an important thing. So it's important, I think the panel previously also mentioned that your networking, your professional networking. So build on your professional networking. So there's some important things that you can do in order to navigate your way into a new organization and working with the rest of the team.
I would like
Yeah.
to ask you a personal question. In my career now, I have seen nurses becoming academicians. You talked about education research. So maybe in the mind of students or of young doctors, the nurse is still the nurse. It's not. Can you comment on that?
I think over the years, things have changed. Doctors that are medical students, doctors that are entering the arena now of healthcare from my experience and from what I've recently seen, has a different perspective. They don't see nurses as just being a nurse and doing a nurse thing. They see them as a colleague, because the reality is that the nurses and the midwives teach a lot of the doctors, especially the basic basic procedures. And that's the reality of my experience that I've had, is that nurses and midwives play such an integral role in facilitating and the transition of any student. So, and yes, there's been a change. A lot of nurses now focusing on education, academia, and research, because they want to be able to engage at the level of the physician or at the level of any other professional, because ultimately we all are healthcare professionals.
I think respect is a very important part of it. Okay, Hala. Yeah, you are into cognitive robotics.
Yes.
So what do you think students need to know about what is in everybody's mouth and mind? AI, Google, robots. So where are we heading to? And what is your advice to the students? What do they have to get ready for?
I would say get ready for the future, because it will actually, a lot of things has changed. Like I graduated like 20 years ago, and the way that we did therapy at that time is a lot different than how we actually doing it today. And how it actually will be even in the future, it will change even a lot. So be ready, get ready for the change, and always like also keep learning. Like it's not like you graduated and that's it. You have the basic knowledge, but you still need to learn all the way. You got like whatever like courses are there, just have these courses and also improve like, knowledge and skills. Don't stop there, because it will always like change. And once we even get to the future will keep changing as well. So it's not always like a static position. You need to keep changing and keep like also evolving.
Okay, Dr. Dalia, Dr. Dalia, sorry.
No problem.
It took me 40 years to become medical director. How did you do that in these few years?
I keep getting this question a lot. Well, basically, I'm very passionate when it comes to work. Really, I put my all into everything when I'm working. So within the first year I entered the clinic, I was literally a fresh graduate. Like I just finished my internship, did my exam, and immediately I got hired. I got really lucky. So during the first year, literally a month before Corona, this was when I almost turned a year, they came to me and they were like, well, doctor, we have been reviewing what you're doing in the clinic, and you managed to do what others didn't do within the past 5 years. With the patients, the relations, the communication between the patients, me, the clinic, with the nurses, with everything. And they were like, we don't know if you can accept the challenge, but can we actually have you as a medical director in the Silicon branch? And I was like, oh, okay. It's a big challenge, but I can do it. I know myself, I'm very passionate. And then with the Corona, with the management, with everything that was going on, with how I had to take care of the patients, the doctors, and how we're working, since we were working under pressure with permissions to come to the clinic in case anything. I tried to somehow make it smooth.
Yeah,
And
you treat doctors, not patients, as a medical director.
Exactly,
right? So
it was really hard.
how would you treat the students? What do they have to expect when they apply for a job?
See,
Are you doing the same as Fauzi?
See, what I can say is when the students are coming, when the students graduate, see, for me, for example, when I was here in the university, I used to always feel that I am covered. I'm hugged from all the ways. So if in case I have something going on, I always have somewhere to go to that will help me and guide me. So basically, when I became the medical director, it was the opposite way around. They all now come to me. So whatever I learned or whatever I gained from the doctors, I tried implying it on me and whoever is under me. And this is how it should be. Like, for example, this is an advice to all the students here. If you do have a problem or you have a mistake going on or something, don't be afraid of it. Just go with it. It's okay. We all have to fail somehow in something in life. Just go back to where you are covered. So basically go back to your doctors, get the knowledge from them because obviously they are more experienced. And this is how I managed it back in the clinic.
So you mean to the students, if you cannot become a surgeon, you can still become a medical director if you have enough empathy?
Well, yeah, actually.
Okay, very good. Yes. Yeah, difficult to pronounce for me. And
You can call me Burhan only.
Burhan, yeah. So I got a little bit scared when I heard you are a psychologist in HR.
Yes.
That is dangerous, no?
That is dangerous, actually.
So can you tell the students what you expect from students in terms of not psychology, but in terms of HR position, what you are looking for? Which CVs are you throwing and which ones are you keeping and calling for interview?
Okay, so there was a very good discussion before this discussion, and I have noticed a couple of things which were said there. The point is, when we take a CV into consideration, we are taking a lot of things into consideration. The most important thing are two: skills, experience, and of course the academic knowledge as well. So when we talk about skills, it's good to write a lot of skills in your CVs. I really appreciate, I love those CVs. But what I'm gonna ask as an HR, what do you have on those skills? Did you practice them? Did you learn them? Like if you can put one skill, communication skill. Okay, very, like it's very general. Everyone put it in their CV. Communication skills. When I'm interviewing you, the first thing I'm asking you, okay, tell me about your background. Tell me about where do you come from? What are your sometimes hobbies? What are your weaknesses? What are your area of development? These are the basic questions I'm asking you. I'm not asking you something related to communication skills. There, I'm going to evaluate your communication skills. So every skills you put on your CVs, it's good to have a very good CV. But those CVs, you need to translate into interviews. When you go for an interview in front of HR, in front of a business director, business manager, you need to translate those CVs. The CV is you in a paper. It's like I'm saying for myself, Burhan is walking in front of interviewers, in front of all the business manager, and a CV. That the CV should explain you in a better way. Don't go for those lavish CVs, very nice AI generated CVs. Those things matter, guys, but you need to be able to explain yourself. That is first thing. The second thing, which is very important, and I'm just gonna actually address the elephant in the room, the AI generated CVs and the chat GPTs and all those things, they are very good. I'm saying use them, but use them intelligently. I will give you an example. Actually, I was interviewing one person online through Team, and it came to my knowledge that the person was answering my questions through AI generated interviews. So it looked so machine, like, okay, I'm asking a normal question and he or she was replying to me in a very, very, machine way. Then I stopped the interview. I thought, okay, we would like to call a physical interview for that. And then I called for a physical interview. And you would believe me that the interview was exactly opposite. I'm not saying he did good or bad, but it was exactly opposite. So that is the thing. Whatever you are doing, you are going to a world which is definitely different from yours. I'm recently graduated, like 10 years back, I would say recently. But the point is, it is a different world. Never compromise on your dreams. Okay, I understand some of the people, they were discussing about, okay, you should be able to accept anything. But I would slightly disagree with that. No, don't accept anything. Learn to say no. You have a dream. You have to reach to that dream. Okay, I understand that there are market dynamics. Maybe there are some bottlenecks coming in for 6 months, a year. It's fine, guys. But never, ever compromise on your dream. It's about you. There are like hundreds of companies. There are hundreds of hospitals, hundreds of pharmaceutical companies. What actually matters most, it is what you are looking to go for. That is the most important part. And another point, the third point, which I would like to add, like black swan moments. So I don't know if you must have heard about this term called black swan. It's like black swan is very, very rare, like once in 100 years or once in 50 years. So what Corona was, a black swan moment. Get yourself ready for that. It can happen for anything, but how ready are you? How updated are you? My one of the panelists, they were discussing about, AI and learning things, and that's the important thing. I've graduated like 10 years back, but I'm still taking trainings. I'm still taking courses. That doesn't mean that I don't know. No, I know, but still I need to update myself. And every one of us, I feel that we need to update continuously. That's the life itself is a learning thing. You do not stop learning. So that's my message only. Thank you.
Yeah, thank you very much. Dr. Shihad, now you are a COO. For those who are not knowing what that does mean, it is Chief Operating Officer. So he is the one looking after the operations, after everything, right, in the hospital. Now, what do you observe in our university hospital with the newly graduates, eventually the last year, terminal year students, and the interns coming to your floors? Any observation, any advice, what we could do better or what they could do better?
Okay. Are you talking about interns, medical interns,
Yes.
or your management interns?
Medical interns.
Medical interns,
These are
okay.
medical students.
Okay.
All students?
I thought there are...
Then all students,
Okay.
fine, sorry.
Great. So at the Tumbe University Hospital, it's of course, with the name, it's a teaching hospital. We have a lot of students coming into the hospital. It's a 350-bedded hospital, and hence a lot of staff and a lot of students as well. Overall, we do have medical, nursing, pharmacy, health economics students, everyone being part of it. I think what I actually see is among the senior or the interns that come in, they really are looking at things, they're really observing things. I can see that they are seeing what they want to be. The good thing is I have interacted with a couple of them. They are looking at different mentors. They do interact with Dr. Fauzi. They interact with Professor Rolf, obviously. Also the HODs in our hospital. Of course, Dr. Omar and team. Dr. Omar is operations head for the hospital. He does invest a lot of time with them in terms of getting them through real life experience in not just the medical graduates, but even the other graduates who are there. So the learning is that there's always people who are looking for that extra, who then go forward to of course do well in their career. It's not just about coming on time and leaving on time. It's more about what you do with that 8 hours or 10 hours or 12 hours of shift. what do you gather? What do you actually experience on the floor, on the ground? Be it for a medical graduate, it's not just for the intern. I mean, it's not just being on the floor and following the doctors, but it's also about getting things done for the doctors, getting things done for the patient, chasing the lab reports, probably chasing the insurance approvals. That's where you learn what real life delay or bottlenecks are, and then you try to solve for them, and you try to help the doctors and the nurses in terms of patient care. So I see a lot of them doing that, and I think I would hope a lot of them would go into looking at how do they make it easier and simpler for their seniors, for their doctors, for their nurses, for their administrative staff, cutting down time, cutting down things to do, and in turn also learning a lot more in terms of doing things.
Thank you very much. So, Dr. Salah.
Yes.
Now, the last question on this first round is, what do you think interns have to qualify for to become a resident?
Okay. So thank you so much for the question. I think the voice, is it okay? Audible? Is fine? Okay. All right. Thank you. So first off, it's a very challenge because of the number of openings for residents are very challenging, especially in UAE. So it is not going to be that easy for you to apply for residency, and there's competition is heavy. It's not only from students in UAE, it's also students from all over the world who wants to come to UAE and also do the residency. So you're not fighting against, you're not in a competition against the pool of crowd over here, but it's worldwide. So the thing is, the best thing I would advise you is to get a mentor. So when you are an intern, who do you find as a mentor? Go after them and try to get the most gist out of them. Once you get that out, you will be able to go to any university or any hospital or anything, and you will be able to speak with more clarity of what you learned, and you can also give reference, a strong reference, because this is where you will ace more than others. Because can the hospital or any clinics or hospital, they can call your mentor and ask them about you, and what would they talk about you? This is where if you can give a very solid reference, you will definitely get what you want. And for this, find the right mentor, and you will get here.
Yeah. That brings us to my question to all of you. Prof. Hamdi was just inversing the soft and the hard skills. So hard, I believe you felt this is hard to learn and hard to evaluate, but actually these are the soft skills, like communication, like networking, all what we already have discussed. Can you tell me in 1 or 2 words how important communication, networking, and team working is, in your opinion, so that students can adopt those hard, soft, floppy, whatsoever skills as soon as possible, as best as possible? And is there any trick?
Well, there is one trick. No. Actually, resilience, or I would say passion. So you need to be an excellent communicator. And I found this like with most of the young dentists who come to me for job, like when we are doing the job interview, yes, they have very good skill sets. They have everything. That's why they're in my room for a job interview. But the other aspect is for the communication where they lack. And maybe even when we hire them, when we see in the clinics, the way that they talk to the patients, again, I would say 90% of the patient grievances that we collect from the clinics, it's all boils down to the communication. It's not about the skills. The patients are not complaining about, okay, my feeling went wrong, or the doctor did this or that or anything. It's about lack of communication. When we look into it, it's just because the doctors did not communicate well enough. So when you ask what is the easy part of it, one, again, as I told you before, find a nice mentor who's an all-rounder. And why I say this before is because the first doctor that you work under, or the first clinic that you work under, is going to be the most memorable place that you ever worked. And that's what is going to shape your future for the next, because this is what you're going to copy and paste into the next clinics. So if you can find, and I would say I spent almost 5 years looking for the right mentor. And finally, I got one. I stuck to him. I learned everything from him, including the communication. And he's the one who opened my eyes into the world of communication, told me how to communicate with the patients, how to build rapport. Building rapport is and how to build trust with the patients, because without this, you cannot actually perform any treatment, no matter what kind of treatment. Maybe you are the best dentist or best surgeon in the whole world, but if the experience is not good enough, they will write a Google review for you just because of the experience. That's it. But your treatment went very well, everything was perfect, but it's all about the experience.
Okay. Dr. Shihad, when you go over the floor, can you point out who is a good communicator, who is a good networking student or not?
Well, it's a tough question, but yes, you can make out and you can say that who's a good communicator. Communication is paramount in healthcare for sure, because
it
all
even
about
includes the administration.
I'm sorry. Though, for sure. Administration, you mean? Yes. In fact, I quite liked the gentleman sitting next to me, where the profile is an HR professional with psychology background. That's like the perfect profile for HR. But having said that, yes, communication is very important, because at the end of the day, the first thing that they teach you in clinical rounds is what's the history of a patient? What's the story of a patient? And it's about the story. It's about how you say your story, or it's about how you have undertaken the story of the patient. Even in the practical ground, it's about how you communicate the story that you've gathered from the patient himself and the labs and diagnostics, and after talking to your teammates or your colleagues in different department, and how you then document. Because at the end of the day, like my fellow panelist also mentioned, was it's all about experience, and you could have been the best doctor, the best surgeon, the best administrator, but at the end of the day, if the communication is not right, or it's off the mark, then the patient is going back thinking that, okay, there was something missing. Right? And it's not just in terms of patient experience. I would take it a few steps further and say, in terms of healthcare professionals, doctors and nurses and everyone, we need to ensure that we communicate well, we document well, to further ensure that we are okay with, say, legal issues. As we know, I mean, we see a lot of medical legal sort of concerns that are raised, but most importantly, once the communication with the patient and the documentation is right, these are mostly resolved. One more factor I would say is insurance, healthcare industry. Insurance is becoming a very real major factor in the UAE. If you all know or don't know, 95% of the people, employees in Dubai and Abu Dhabi are insured, and Northern Emirates is going to be insured in the next year. It's going to be becoming mandatory. So again, so all your patients who come in would be insured. And at the end of the day, if you can take the right story from the patient and put across or present the right story in your files, that's important, and communication plays a major role.
I just got instruction, only one more, And I would like to hear from you, from this nice case you have presented, what is your importance of emotional communication? If it was robotic first, was the second emotional?
Actually, I was coming to that point, emotional, very, very important point. So when we talk about communication in general, what we talk about, how do we communicate? The most important thing, what we actually do not mention that much, how do we listen? That is the most important question. Communication, listening is 50% part of the communication. Usually, when we listen just sometimes we listen just because someone is speaking and we want them to finish. And then we want to reply as much as possible. The most important part of communication is how much you are grabbing from someone who is talking to you and answering the question, or not just for the answering question, but just to give them a hint of that you understand them. And especially in your profession, in healthcare, it is very, very important. Because if you are not listening properly, maybe it is a different case altogether. Okay, when it comes to the example I gave, emotions, of course, are very, very important. So when I'm asking question, I don't know, it's maybe I'm because I'm a psychologist, maybe so I would say from that perspective also that I can read certain faces, not all of them, but for sure, yeah. So that's where it comes to the picture, that your emotions, that when you are replying to a question, how genuine you are. And believe me, I'm not saying as an HR background psychologist, but most of the HR, not only HR, most of the manager who are top managers, they would understand you the second you lie. So you need to be very, very specific when you are going down to an interview, when it comes to the emotional connection. And the very important thing, which is which relates to emotion and emotional intelligence, is the way you are saying things. Sometimes you are empathetic, sometimes so you have to have those various of emotions in you when you are going for an interview. Not only an interview, I would say when you are in a normal day-to-day routine as well. So that is the part where you do all the activities, like listening is very important, and then goes for the emotional connection.
Thank you very much. I would have liked to hear the voices of the ladies, but sorry, time is up, Dr. Dalia. So maybe we can discuss later. What about the robotic answer?
No, I just want to say one thing because I know it's I want to say don't stay in your comfort zone. Like later on, just any opportunity, any challenge, just take it, because this will actually improve and it will even enlarge your comfort zone. So don't stay in your comfort zone, because you will find a lot of challenges later on. Take them all. Don't wait. Okay? Just go.
Thank you very much. Chancellor, you will be.
We'll quickly thank our presenters today. So just please bear with us for 5 more minutes while my team is preparing the stage. As you know, Gulf Medical University started in 1998. And when we visited, if you visit this campus 25 years back, you will see desert all around. And Gulf Medical University was established by our founder president, Dr. Tumbe Moideen. So a short video to just introduce our activities. I think it's very important to play this video. And after that, we thank all our participants with a token of appreciation. I request my AV team to just play this video. So.
I started the Gulf Medical University and Dubai Hospitals in Ajman. We have grown over a period of time in 26 years. Gulf Medical University is a very premium university, one of its kind in the entire Middle East. And I happen to be the only Indian who has built a medical university outside India in the Gulf. We have a campus of about 1 million square feet of land and 1.2 million square feet of built activity. Students from 100 countries, 8 colleges, 6 of them established, 2 of them happening now, many institutions, 3,500 full-time students and 1,000 part-time students. The healthcare division owns 7 hospitals, 5 medical centers, 5 laboratories, 46 pharmacies, all are academic setup. Students from various colleges are being trained in this setup. Very unique, very trend-setting, and very innovative of whatever they are doing in this land. Every hospital, every clinic, every pharmacy has an element of teaching and training students. And we are the only academic health system in the private sector in the entire life. We are one of the only few universities which is going to be a research university which is fully different. All this established, we have almost 15,000 floating population coming into the campus every day. Some of the projects which are very unique and futuristic, our AI college being established in healthcare for health varsity, which could attract up to 100,000 students online in the future. Dubai Hospitality Division is a subsidiary of the Dubai Group. It mainly caters to hospitals and universities. The restaurants cater to the inpatients in the various hospitals. We have created a chain of coffee shops called Blends and Brews. The coffee shop also cater to the patients and the people who come into the hospitals, universities. We have health clubs called Body and Soul, which caters to both men and women. For also other businesses, retail, Dubai pharmacy, more and more people shop, travel shop, technology called Dubai Technology. We have a construction company called Dubai Builders. We also have a media company called Dubai Media. We publish magazines, get the Health magazine. We also are coming up with 2 new magazines called Gulf Expatriate and Gulf Education. The future plan in healthcare, which can be scaled up to other countries in the next 4 to 5 years. It's one of the biggest success stories in medical education in the entire Gulf. My dream is this legacy continues. I have 2 sons, Akbar Mohiuddin Dubey, who heads the healthcare division, and Akram Mohiuddin who heads the technology and construction division. In fact, I want the family to continue this legacy for generations to
Definitely, all of you will experience our hospitality. We have arranged lunch for you in our food court, so all of you will join us for food. Without any ado, I request our President, Dr. Omar of Alumni, please escort our Chancellor and Vice Chancellor to present the token of appreciation to all our speakers. Please. Once again, I would like to thank all of you who have participated in the Career Fair 2024. It's a wonderful event which has brought the industry, the alumni, and the students together. I would like to thank Say something. Okay.
Well, I'm very pleased, really, of what is happening today and the wonderful panelists and your contribution. And I want to announce something that I don't want this day just to end by just one day, and maybe next year we'll have another one. I would like to take this opportunity and all our alumni, our industry partners, we want you to be part of this university. And you can see the value of your contribution in building the future healthcare professionals. And it will be a pleasure for us, if you are interested, to be appointed as an adjunct faculty in our programs, in our colleges, depending on your specialty and your job. And so in the 6 colleges which we have, the College of Medicine, Nursing, Pharmacy, Dentistry, Health Sciences, all the health sciences, and Healthcare Management and Health Economics, which include HR, of course. So you are more than welcome. Please send your CVs to our HR, and Professor Manda, he will look at it and will communicate with each one of you who are interested. And then we'll have you as part of our faculty, and you will have one of our cards that you are a faculty, an adjunct faculty at GMU. Thank you. Yes. He reminded me also, Vignesh, of something, an initiative which we launched it recently. And again, it goes with the vision of the founder, Dr. Sombe Mohyeddin. We have established for the first time in a private university, the Sombe International Medical Research Grant, 3 million dirhams annually for research. And we have 4 domains for this year, or for this cycle, I would say. One is related to cancer and immunology and drug discovery. That's one. Second, in the area of population health, regenerative medicine, and healthy lifestyle. So you can see from pharmacy, from other, they can all think of that. The third one is artificial intelligence and technology in healthcare. And the fourth one is about innovation in health profession education. So if any one of you is interested in research and have an idea, you can collaborate with one of our faculty researchers here, and together they can submit a letter of intent, hopefully within the coming 2-3 weeks, and then we'll look into it. It will be just a letter of intent, which is almost just 1 or 2 pages. The full proposal can be written and sent later on. So please apply for this initiative. Thank you.
Thank you. And quickly we move to the presentation ceremony. First of all, I would like to call upon Mr. Pankaj, founder QLabs. Thank you very much for gracing this occasion, and we are very grateful to you for joining this panel discussion. Next, we have Dr. Pozi, Medical Director, Tumbe University Hospital. Thank you, Doctor, for leaving all your patients and coming here and sharing the knowledge. Next, we have Mr. Austin Shaju, Chief Operations Manager, 360 Medicare Healthcare. Thank you very much for joining us today. Next, I would like to call upon Dr. Asma, Head of Medical Education and Research, Specialist Pediatric Dentist, Apollonia. Next, I would like to call upon Dr. Zaki, Pharmacy Operations Manager, Altika Pharmacy. Next, I would like to call upon Dr. Zaki. Dr. Shihad Kader, CEO, Tumbe University Hospital and Tumbe Hospital Ajman. Next, I would like to call upon Hala Abu, Head of Therapy. Next, I would like to call upon Mr. Burhanuddin, HR Manager, Middle East Tabuk Pharmaceuticals. Next, I would like to call upon Dr. Salahuddin, Medical Director, Pearl Dental Clinic. Sorry. Yeah. Dr. Salahuddin. Dr. Dalia, Medical Director, Medicure Polyclinic. Ms. Tracy, Director, Nursing Education and Research, King's College Hospital, London. And last but not least, Professor Rolf, who did the second panel discussion. Chancellor, he keeps giving, so. Professor Rolf. Let's all take a group picture with all the speakers and the deans. Please join us so we can take a group picture and capture this moment, which is very important to us. And I request Mr. Omar to please deliver his vote of thanks. Let us all first take a group picture. Dr. Omar, President of Alumni Association, thank you very much, sir, for joining us today. First picture. We'll take a group picture and then okay. On behalf of the Gulf Medical University Alumni Association, I thank you once again all for joining us today. We have arranged lunch in the food court of Tumbe University Hospital, the next building. So after you've gone to your stall, and our volunteers will guide you to the food court. Thank you once again for making the GMU Career Fair 2024 a grand success, and see you next year